Good morning everybody. Today's my topic is about correlation between glycemic index and retina nerve fiber layer, thickness in type 2 diabetes mellitus, a comprehensive study. Introduction. The aim of the study is to generate the data on retina nerve fiber layer thickness in a tertiary care center. It aims to study if there is any correlation between RNFL thickness with blood glucose parameters. Coming to diabetes mellitus endangers sight by damaging the neurovascular system of the eye, including the optic nerve. It's crucial for individuals with diabetes to manage their blood sugar levels, blood pressures, cholesterol, as well as to undergo regular eye exams. Recently, HbA1c measurement is regarded as the gold standard indicator for glycemic control in diabetes. This reflects glucose levels over 2 to 3 months of period. RNFL thickness is the innermost layer of retina and consists of nerve fibers that originate from the ganglion cells. RNFL thickness is found to correlate with optic nerve involvement and visual acuity. Hence, measurement of RNFL thickness is not only a descriptive entity but also used as a predictive parameter. Inclusion criteria: age more than or equal to 45 without clinically significant macular edema, and intraocular pressure below 20 mm of Hg, and also requires a good quality of OCT. Characteristics were recorded including age, sex, type, and duration of diabetes, blood glucose parameters. Exclusion criteria: systemic illness other than diabetes mellitus, any ocular surgery, more than 60 years of age to avoid age-related thinning, previous history of glaucoma, ocular trauma, congenital ocular disorders, or any other neurodegenerative diseases, or any changes in corneal curvature. Materials: RNFL thickness was measured by APOS 2018 IAPB spectral domain with RNFL and ONH with optic disc cube protocol. Each reading was an average of 3 consecutive readings. If any image was found to be distorted, it was rejected and new set of readings was taken. The blood parameters for glycemic status like fasting blood glucose, postprandial blood glucose, and glycosylated hemoglobin was done. Methodology: cross-sectional. This was a cross-sectional study in a tertiary care center. The patients were at first explained about the procedure in local language. The ongoing treatment for diabetes was not changed or withheld. The pupils were dilated by topical dilatation drops using 1% tropicamide and 2% phenylephrine for examination. Each eye took an average of 3 minutes, including time for alignment. High-speed image were obtained by resolution of 3 micrometers. A circular area of diameter of 3.6 mm around optic nerve head around 12 degrees was measured for retinal thickness with infrared rays of wavelength 830 nanometers. All the readings were taken by the same person. Each reading was an average of 3 consecutive readings. The actual RNFLT in microns in the 4 quadrants superior nasal, inferior and temporal of the circle was given along with the color coding grading in each quadrant. Green depicts normal, yellow depicts borderline, and red depicts thin. So this is the picture of showing the OCT image, where you will have a quadrant images and also seen in clock hours. Results: we had a total of 50 patients, which means 100 eyes, and average age of the participants were 53 plus or minus 8.1 years. Out of 100 eyes, retinal thickness was low, 10%, 95% confidential intervals. The average HbA1c levels in those with lower RNFL thickness was significantly higher than other groups. The average RNFLT around the optic nerve head was correlated with blood glucose parameters. For FBS correlation coefficient ratio was minus 0.19. For PPBS is minus 0.32, and for HbA1c, which is correlating, is minus 0.46. The discussion: the cross-sectional study shows that a large number of diabetic patients had thinned out RNFL and blood glucose parameters has significant negative correlation with HbA1c. The pathophysiology behind RNFL thinning is a multifactorial. The exact mechanism is still debated, but probable theories include ganglionic cell dysfunction and apoptosis. Chronic hyperglycemia is also said to affect neurons. Chronic hyperglycemia activates lots of metabolic pathways that ultimately lead to activation of nuclear factor kappa B. Nuclear factor kappa B leads to oxidative stress in the retina and damage to neuronal tissue. Metabolites of the retinal angiotensin system, especially angiotensin 2, activates AT1 receptor in the retina and leads to oxidative stress and damage to RNFL. In conclusion, the retina nerve fiber layer thickness as measured by OCT is significantly decreased in diabetes, and this correlates with blood glucose parameters especially for HbA1c. There is a significant negative correlation. The correlation was also high in all quadrants around the optic nerve head. Strict glycemic control may be an effective treatment strategy to prevent retinal changes and retina nerve fiber layer at early stages. These are my references. Thank you.
Okay. So any particular cause for excluding abnormal corneal curvatures in your study?
Like OCT, in case of OCT, if any corneal curvatures also affects, there is a study
Does that affect your imaging
that affects
of
the
RNF?
imaging of the RNFL.
Okay, so how do you want to explain the patients about the prognosis? I mean, if the RNFL thickness is less, is it going to progress more? I mean, diabetic retinopathy, is it going to progress more?
Yes, it's going to progress, ma'am. But not only that factor, but if the patient is above 60 years, more than age of above 60 years, we will also explain that not only due to the diabetes, but also age-related thinning, it also exists within correlates, goes simultaneous hand in hand.
Along with diabetes.
Along with diabetes.
What is diabetic papillopathy?
Sir?
Diabetic papillopathy.
In case any papilla, along with the retinal changes, there will be papilla.
Actually, the disc changes present in the diabetes. It's more prominent in is unilateral, and more we can see in proliferative diabetic retinopathy and ischemic maculopathy. Okay.
So without knowing pre-diabetic RNFL thickness, how can we know it is decreased, whether it is
So actually, only thing is like we should take a pre also, sir, but only thing is we have taken the studies like cross-sectional study only for the people.